Hi, my name is Marlene and I'm a medical assistant, and today I'm going to be informing you about STD prevention. STD stands for sexual transmitted disease. It is when one person that is diseased has sexual relations with another person, such as oral, vaginal, or anal sex. There are two types of STDs. The first one is bacteria. Bacteria can be cured as long as you take the proper antibiotics. The second one is virus. Virus cannot be cured, but could slow the spread by taking medication. STDs are very common. There are many STDs, such as chlamydia, gonorrhea, HIV, AIDS, and genital herpes. If you have multiple partners, make sure to check yourself 3 to 6 months. If you only have one partner, at least check yourself every year. There are many clinics you can go get yourself tested for STDs, such as Planned Parenthood clinics, your doctor's clinic, and healthcare clinics. The procedure for STDs are different all the time, such as urine samples, blood samples, swabbing in the mouth, swabbing in the genitals for females and males. Females and males are different. Females, it's swabbing in the cervix, and for males, it's in the urethra. There are ways to prevent STDs, such as using condoms, at least having one partner at a time, talking to your partner before having sexual relations with them, and getting yourself checked, both of you guys, before having sexual relations. Get checked frequently. Get your vaccinations, such as your hepatitis B shot. If you do get an STD, do not ignore it. It could be dangerous and it could worsen. Do not treat it yourself. It needs to be medically treated by your physician. Your physician will prescribe you with your medication. Do not use someone else's medication. It could be very dangerous and it could just also worsen. If you have an STD and your partner doesn't, make sure to communicate with them and let them know before you guys get into any type of sexual relation. You want to let them know and be prepared what to say. If they have any questions, inform them. If pregnant, you should always ask your OBGYN if they could do an STD test for you. Sometimes they do offer it, but sometimes they do not offer it. It's better to be safe. You still want to prevent STDs when pregnant, such as using condoms and only sticking to one partner, not having multiple partners. If pregnant and you do have an STD, you want to let your OBGYN know ahead of time. That way they can treat you and your child. You might need to get a C-section. Most of the times that's necessary when having an STD. It is important to have a support system, such as friends or family. That way you can feel safe and you can feel comfortable. A minor can get an STD test. It is legal from 12 or older. There is a number that I will be providing. A minor is allowed to call this number if they have any questions or concerns. It's not legal to get a parent's consent if you're a teen for an STD testing. Sometimes teens feel more comfortable and safe when their parents do not know. You need to be aware, safe, and be careful when having sexual relations with your partners. Thank you for watching, and I hope this helps you guys.